which really doesn't leave you very much room in there, but it can happen. So I hope that that answered that question. Not exactly succinctly, but you know, I had to cover all of that. Okay, let's move on. Next question. Oh, okay. I want to have a natural childbirth, possibly at home. My husband is not at all in favor of this. Any suggestions? No, I have no suggestions whatsoever. You got to be in agreement. I think that, first of all, not a lot of people do home births. We have our culture here is very, is a very sort of medically slanted culture. The idea of not giving birth in a hospital seems not only alien to most people, but downright dangerous. And the truth is, it's not dangerous at all given the right circumstances. The other part of that problem is that, well, if I say this, I would have to like sort of support it with a whole bunch of statistics and you know, and statistics and data that would tell you that something like the maternal death rate in the U.S. is actually quite high, all things considered, for us being like such an advanced culture and country, whatever. But I think the reason that that happens here more frequently than other places is because medical intervention often means cesarean. And with a cesarean section, you're doing abdominal surgery. And when you're doing surgery, surgery comes with its risks. So if you sort of follow that path down, then yes, there are going to be women who will have some sort of complication, or there'll be some, you know, error in whatever, you know, in actually performing the surgery that will lead down the road to maternal death. I mean, obviously the things that people worry about is a baby dying during childbirth or a mother dying. Obviously, everyone wants to keep things as safe as possible. And really, you have to do what's comfortable for you. Some people just don't like hospitals and don't like a medical environment. And the idea of giving birth is not seen as a medical event or like this, you know, catastrophic thing, or this thing that has the potential to become catastrophic. Many people see birth as just this natural thing that women do, and to need all this sort of intervention and so forth not only can seem extraneous, but also can seem counterproductive. Like, in other words, it's not the right environment. The environment itself may not be comfortable and conducive to birthing in a comfortable way. So that's why I'm saying you have to choose what's really comfortable for you, you know, your sort of comfort zone. And for many women, a birthing center in a hospital setting is a nice compromise. And so for this particular person asking this question, that might be a great compromise, because you would be in a hospital so that should anything possibly go wrong, you would be tended to immediately. And in a birthing center environment, you have what looks like a hotel room, really, like a big bed and a birthing chair and a jacuzzi to help you manage labor pains. Sorry, I was like thinking ahead of myself. But the medical side of it is really like tucked away. In fact, I like that in birthing centers they sort of have this secret like James Bond panel on the wall that has like the oxygen and things behind it. But obviously it's not an operating room, so there's nothing like too heavy is going to go on in the birthing room. Yes, somebody might give you an IV or some oxygen if you were like really very weak towards the end of your labor. Which reminds me, you know, labor is obviously an enormous amount of exertion and very tiring for a woman, and it is the only hard labor, exertion, whatever, that people do where it's like medically advised not to eat or drink. And this is something that goes on quite frequently in hospitals. Do you know why? Because the idea is that you might actually need emergency surgery, and you are not supposed to eat or drink before you have surgery, as most people know. So the idea that like all birth has the potential of like, you know, this emergency surgical ending is rather unfortunate and extremely pessimistic. So if you are ever, if you're laboring under the watch of a midwife, you would never be denied food or drink. I mean, it's actually considered dangerous to deny a woman the sounds of Jersey City. I was saying that I think it's actually considered dangerous to deny a woman food or drink during labor. And what I mean by dangerous is not dangerous like she's gonna, you know, go into like some kind of convulsions or something, but it puts her in a weakened state. And labor is hard work. And the final stage of labor, when a woman is most taxed and tired, is, you know, the most difficult of all. So, you know, I don't know, it just, intuitively it doesn't make any sense, but it's been the protocol for doctors and in a birth that's in a medical setting to do that. And again, I said because the potential of ending up in a medical emergency and having surgery. I also have to clarify that because your idea of what that may be a cesarean section. And if a woman has been given an epidural, right, so she's numbed from the waist down from the epidural drug, she can go right into the labor room and have a C-section without issue because the epidural is in place, and she can remain awake. But if she doesn't have an epidural already in, let's say she was trying to do a natural childbirth and then something went terribly wrong at the end, and by terribly wrong I mean extreme fetal distress. When a baby is being born, there's a certain amount of distress. It just happens. I mean, babies' heart rates will fluctuate greatly during the course of labor. This could be for any number of reasons. The baby's position, where the umbilical cord is. Some babies have the umbilical cord wrapped around their neck, which is not as like crazy serious as you might think it is. Baby is not breathing, you know, through its nose, obviously, until it comes out. But the constriction of the umbilical cord can be dangerous. Sometimes babies are born with the umbilical cord in their hand. And labor is squeezing them. So, you know, there's this cutoff sometimes of air supply to, or whatever, blood supply to the baby, which sometimes causes a dip in their heart rate. What I mean by extreme fetal distress is if, like, you know, I don't know, the heart rate plummets and doesn't go back up, and, you know, or something, you know, something happens that causes doctors to say, okay, we're cutting you open immediately, and, you know, we got to save this baby.